let's demystify a few things. One, something called episiotomy. What's an episiotomy? You have a table here and it's landed towards this side, and you pour water here. This drop of water is rushing towards to come get spilled here. You can, before you get something to wipe it, you can distract this by drawing. We used to do this as kids. Just draw patterns on it just to direct the flow of the water. So we're talking about the vagina now. Vagina is there, the clitoris, the urethra. This is the introitus, where the baby will come from. So normally, this is the weakest point. This is the anal opening, and actually this is the whole idea about episiotomy. And please listen to what I'm saying, not from what you've been told. So this is the anus, this is the introitus, this is the weakest point. So once the baby has negotiated through the bones, just the muscle now just about to come out. For some ladies, few, a very small percentage, not all, the baby's head, these muscles, they do not relax enough to let the baby's head and shoulders and the rest of the body pass through. So if we just let you be, sometimes you can actually get a tear through here. This tear sometimes can get so bad it actually gets the anus, called 4th degree tear, and leads to something called RVF, rectal vaginal fistula, and also kills this sphincter for holding stool. So the reason I give an episiotomy is normally to prevent this from happening. The other ways of doing that by supporting the perineum here, but still we still check. For some ladies, these muscles are too tight. So what do? We divert this force, and we give lignocaine, something to make this place numb. Then we make a small cut, not a big one, a small cut, just to divert the force, to make this, to create an area of weakness through here, such that if the baby comes out, there's any tear, it goes in this direction towards the vagina, which, as the vaginal muscles, which avoids this. This one, no need to worry. We put 2 or 3 stitches, and we tell you to throw some warm salty water there. 3-4 days, it heals. This place has very good blood supply. So episiotomy, it's indicated not in all ladies, but when it's indicated, it's a good thing to prevent all these tears. All right? Yeah. CS delivery. Here we're talking about emergency cesarean section, is where you've tried to give birth normally, and something necessitates us to take you for cesarean delivery. And the commonest is one, a baby factor. If a baby gets tired, in layman's language, but there are ways you know that the baby is tired. One, something called meconium stain liquor. It's graded 1, 2, 3. 2, fetal heart rate. This is what we monitor, fetal heart rate every 30 minutes during active first stage, and every 5 minutes when the baby is just about to come out. It initially starts to go high, more than the usual 110 to 160. Then the moment it starts dropping down about actually 120 and less, trouble, we rush you for emergency cesarean section. And also a baby getting tired, the other factors, especially if using a machine called CTG, you can be able to figure out from the tracing what's happening. These are baby factor for emergency cesarean section. The reason why we monitor mothers during labor, check their blood pressure, fetal heart rate, is so that you're able to identify this earlier so that we intervene. Because we've said that expectations are healthy baby and also a safe delivery for the mother. Number 2, commonest reasons, talking about prolonged labor. Prolonged labor, we are talking, we are a very slow progressor from about 5 centimeters to full dilatation of 10 centimeters, about 12 hours or so. If 8 hours down the line, you are still 5 centimeters and yet you are at 4 centimeters, we start worrying. Could there be something else? Maybe the baby is bigger than usual. Is there a cord around the neck which is preventing the baby from coming down? Yeah, prolonged labor is also a common indication of cesarean delivery. This is a topic on its own about how it's done, and many questions about spinal delivery, anesthesia, general anesthesia, and all that. So number 8, a colleague of mine has discussed about this. What do you come with? What to pack? You're taking a small trip. get a newborn, somebody new, you want them to have their own new stuff, baby clothes. Talking about the basics. You need for the mother, you need the maternal pads, not the small ones. I know this brand, Medicot, blue or pink. Need about 3 packets or so, because there's usually heavier bleeding after delivery. Then you need some cotton wool. Then you also need personal effects for yourself, a toothbrush. You've taken a small trip, just about a day, and overnight is normal delivery, about 2 to 3 days is a serial delivery. And the others, which I'm sure they'll be discussed by my colleague. And of course, don't forget your NHIF card, your other insurance cards, plus your antenatal booklet or your antenatal records, plus all the scans. Yeah. Number 9. Questions? We call it off.